Hello everyone, my name is Immanuela Nicole Enwesi. I'm a sophomore neuroscience major at the University of Maryland, and I'm also a global public health scholar. Today I'll be talking about my Practicum project, which is focused on the documentation in health funding. My Practicum work started when I first found out about my field site, Angel Loving Care Incorporated. When volunteering at an event hosted by the Prince George's County Department of Social Services, I heard about the type of work they do for the community and was enticed to get my hands on it and work alongside them. Angel Loving Care opened in 2008 with the goal to provide inpatient, outpatient, respite, and community living to individuals with disabilities, while also helping them lead normal lives and taking them out to excursions. When one thinks about the aforementioned care, it's easy to assume that the biggest and most integral piece of the work are the nurses who provide the actual care. Yes, the nurses do a large part of the work that people can see, but the behind-the-scenes work is equally as important. My work focused on the documentation preceding and proceeding the care of the patients. In global public health, funding plays an integral role in the lifespan of the type, quality, and longevity of care organizations can provide to the patients who need it. When the funding is government sent, it requires a lot of rules to be followed to the T in order to make sure that the money keeps coming in, and understandably so. The government is trying to make sure the funding is actually being used what it's supposed to be used for, which is patient care. Many of the patients in Angel Loving Care were waiver recipients from the state, which means that the money being used for their care came directly from the government. I had to become extremely familiar with the types of documentation which varied by patient based on the state or district that they lived in. Our patients were serviced both in Maryland and District of Columbia, which required slightly different documentation, and for the organization to follow different parameters. Inpatient care had different code listing and pay per hour amount than home care or other services provided. I looked through years of documentation over my time at Angel Loving Care, making sure that the times and types of care were accurate on the patient's hour log. I also checked for inconsistencies in the care patients would receive and flagged any documentation that could be incorrect or had missing dates and time. Since nurses did physical documentation as required by the government, papers could easily get lost, which many did. When we found the records of the care that the patients had received that were lost, we filled out the documentation and placed it back into their file. After ensuring the correct information was in the physical documentation, I entered the patient logs into the individual Maryland and DC virtual systems. This process is extremely lengthy and must be done meticulously, as many errors may have a ripple effect. For one, when the organization is audited for this information, inconsistencies in reports and documentation could and will result in less funding and out-of-pocket pay for the organization, which directly affects the staff, and they provide the care to the patients. So at the end of the day, incorrect documentation will have a direct effect on the patients. While working there, I can only imagine that there were easier ways to log patient care hours that would eliminate much of the effort put into the documentation. This is when I developed the aspiration to create a virtual form that consists of all the information of the physical forms that the nurses and caretakers can fill out. This form would then automatically fill in the data onto the required documentation of the government form, which we can then print out and store in the patient's files. This would prevent a lot of lost paperwork, would make flagging inconsistencies easier, and would also just take less time overall. Angel Loving Care's work doesn't just end in the office or through clinicals, but also goes further and beyond than typical care. They enjoy taking their patients out on excursions. As you can see in image number 1, this is one of our patients on a trip to a museum, and in image number 2 is one of the annual end of the year galas, which is thrown for patients and staff. You can see that the patients and staff are extremely close, and this is where they gather. Having been to one of these events, this is where I formed my personal connection to not just the patients, but also to the work that I'm doing. If there's one thing I'd like anyone to take away from my work, is that documentation is an extremely important and integral part of global public health outreaches and in organizations, and that proper documentation makes the difference between good and bad patient care.